This video will explain and demonstrate the process of priming the tubing system for an arterial line using the Edwards Lifesciences Truwave with Vamp plug tubing set. For a more in-depth and detailed explanation of the tubing system and priming process, please view Introduction to Arterial Lines, Priming and Setup of an A-Line. Prior to the placement of an arterial line, which will be done by a trained healthcare worker, the tubing must be primed and set up, ready to be connected as soon as the line is in place. Begin by gathering your supplies. You'll need the Edwards tubing set, a bag of saline. A liter bag is used here, but a 500 milliliter bag is sufficient. A pressure bag, a blunt tip needle, clean gloves, and an IV pole with the tubing clamp, and, if you will be using it, an arterial pressure tubing extension set. The ArtLine system must be completely free of all air, including the air in the saline bag, so begin by bleeding the air out of that bag. Use the blunt tip needle. If your bag has a resealable port for adding medications on the bottom, insert the blunt tip here. Squeeze out the air and remove the needle. The bag should be completely empty of air. If you have a bag like this liter bag that doesn't have the second medication port on the bottom, use the blunt tip needle on the tubing port and squeeze out the air. But because this doesn't reseal, you can't let go of the bag until it's spiked, or the air will re-enter the bag and you'll have to start over. So, while you are squirting saline out of the bag, remove the needle and quickly spike the bag with the tubing. Again, ensure all air bubbles are removed from the bag before continuing. If you haven't already, open the tubing set. Check all the connections along the line to ensure they are tightly connected. Find the small bag of line labels in the kit and label the reservoir and the line with the red arterial line labels and dots. There is also a white replacement end cap in this bag. Leave it in the bag for now. We'll need it during the priming process. Now place the saline in the pressure bag. Hang it on the IV pole and inflate the pressure bag to 300 millimeters of mercury. There is a gauge on the pressure bag that rises as pressure increases. When you see the green line emerge, that indicates that you've reached the desired pressure of 300. While this art line is in place, it is vitally important to ensure that the pressure bag is always inflated to a pressure of 300. If you ever walk into the room and don't see that green line, immediately inflate the bag further until it is showing. Also, remember to close the stopcock on the pressure bag bulb. The valve needs to be turned off to the bag so that no air can leak out. If the bag is not off, air will be able to escape the bag through either the side port or the bulb, and you won't be able to maintain the pressure of 300 millimeters of mercury on the saline. Next, attach the tubing to the clamp. Slide the transducer into the bracket so that the stopcock is on top and the pigtail is on the bottom. Slide in the reservoir so that the plunger is on the bottom and the tubing attaches to the top. And slide in the vamp port closest to the reservoir, oriented horizontally. The stopcocks, reservoir, and roller clamp are all packaged in the required position to begin to prime the system, so there is no need to manipulate any of these at this point. You'll need to clear all air from the system. Do this by pulling on the small blue pigtail on the transducer. You will see fluid begin to immediately fill the tubing until it reaches the reservoir. That will fill, and then continue to prime the rest of the tubing. The patient end of the tubing is packaged with a small white cap over it. The cap has a small hole, so when fluid reaches the end of the tubing, it will shoot out in a fine stream. Drain it into the sink or the trash. Return to the reservoir. Push the plunger up until you hear and feel the plunger lock click into place. Fluid will continue to squirt out of the end of the tubing while you do this. Then, to ensure that there are not small air bubbles still in the reservoir, pull the pigtail for a few more seconds to clear them from the line. Now assess the tubing looking for any remaining air bubbles. Make sure you clear all bubbles before proceeding. There is still one port left to prime. It's the side port above the transducer. Retrieve the white replacement port cover from the package. Return to the transducer. Turn the stopcock off to the patient. If the transducer is in the appropriate position in the clamp, that will mean pointing the lever up. Remove the existing port cover. You can throw that away. Pull the pigtail, and you should see saline start to exit that port. Let go of the pigtail and connect the new white cap. Then turn the stopcock to the right so that it is off to the outside port you just drained. Your tubing is now primed, but now you should take the time to level the transducer to the patient and connect the monitor. First, you need to level the transducer with the patient's phlebostatic axis. Locate the patient's fourth intercostal space and imagine a line horizontally at that level. Then locate the patient's mid-axillary line. Where these two lines cross is the patient's phlebostatic axis. Move the IV pole in line with this point and position the clamp with the transducer up or down as necessary to set the transducer at the same level as the axis. The reference point on the transducer for leveling is the small black bar just above the pigtail. That should be level to the patient's phlebostatic axis. Now connect the transducer to the monitor. Simply take the cord attached to the transducer and plug it into the corresponding cord on the monitor. Now, as soon as the line is placed and connected to the tubing, you should be able to see a waveform on your patient. At that point, you'll have to zero out the system. Now, if you are utilizing an arterial pressurized extension set, you'll need to prime that as well, but you'll do that during the line placement procedure. Line placement is a sterile procedure, so connecting the extension set will require sterile technique. When the proceduralist is ready, sterilely drop the tubing onto the sterile field. The tubing has a yellow cap on one end and a white cap on the other. The yellow end will connect to the patient, and the white end will connect to the primed tubing system. The extension must remain sterile, so only the proceduralist will touch the extension, but we need to prime it before we can connect it to the patient. The proceduralist will remove the caps from the ends of the tubing and hold the white cap end towards you. You must remove the white cap from the end of the tubing system, and without touching the extension set or the proceduralist, insert the end of the tubing into the extension set, and both of you should twist to secure the connection. Then you will need to pull the pigtail until saline is exiting the extension set. Now it's primed and can be connected to the patient. As previously stated, you should see a waveform when you connect to the patient, but you'll need to zero the system to get an accurate arterial pressure reading. Ensure the transducer is still level and in line with the phlebostatic axis. Go to the transducer. Turn the stopcock off to the patient by turning the lever up. Remove the cap from the side port on the transducer. Be careful to maintain the sterility of the inside of this cap until you replace it. Pull the pigtail to drain a small amount of saline. Now go to the monitor. Select the box representing the A line you are connected to. On the screen that pops up, select 0. It should show zeroing for a few seconds before changing to zeroed to let you know it is complete. Replace the cap on the port. Turn the lever off to the side port. Your monitor should show an accurate arterial waveform and pressure. These are the steps that you will use whenever you need to zero an art line that's already connected.